Welcome. My name is Christine Tucker, and I'm a staff member of the Maternal Health Learning Innovation Center, and we're so glad you're a part of our symposium. I am thrilled to introduce our speakers today. Amy Mullenix is the Senior Collaborations Manager for the National Maternal Health Learning and Innovation Center, as well as the National Maternal and Child Health Workforce Development Center, both of which are housed at the University of North Carolina's Maternal and Child Health Department, where Amy also serves as an adjunct professor. She's previously worked for local public health departments, a federally qualified health center, a hospital system, and state MCH nonprofit agency. She'll be presenting with Jimmy Dills, who is a Senior Research and Health Integration Associate at Georgia Health Policy Center. He works to improve public health by advancing a health in all policies perspective of decision-making. Jimmy's areas of expertise are systems thinking, which he's going to share with us today, health impact assessment, and healthy community design. Today, they'll be presenting on using whole systems maps to deepen understanding of maternal health services in a complex system. And they really welcome questions and want you to participate along the way. So feel free to come off mute if you have a question and use the chat as much as you want to. Thanks so much. I'll turn it over to Jimmy.
Great. Thank you, Christine, and welcome to everybody still coming in the room. And we do want to emulate an in-person environment as much as we can. So if you're willing and able, please show yourselves on video so we have somebody to look at. Otherwise, I can talk to Christine and Amy just fine, but we do that a lot. So would love to see some of the folks out there. All right. Thank you for coming on video. So you are in the Using Whole Systems Map breakout session. And as we sort of warm up a little bit, we're going to try to employ the chat here, or if you're comfortable just coming off mute and letting us know. If you could be outside right now, getting some exercise, doing something active, what would you choose to do? I like to play disc golf. Amy likes to take a walk in the woods. Those things are pretty similar. But what are folks out there? What are the kind of things you like to do if you can get outside, assuming it's not raining or there aren't wildfires around you wherever you are right now? Biking, walking in the woods, swimming, that's a good one. Definitely in the woods, walk along the river. So maybe a riparian environment somewhere. Maybe there's woods by the river that you're walking on. Reading in the sun, so relaxing. All right. Sitting in or by the ocean. Horseback riding, that's a good one. All right. Absorbing as much vitamin D as possible. That's a good thing to be doing out there. All right, well, thanks. So we know your keyboards and your fingers are out there working and getting you warmed up for the session here. So now let's move into that a little bit. You chose this session as one of the concurrent sessions. So just quickly in the chat, what are you hoping to gain from participating with us over the next hour? All right. So what is the whole systems map? That is a great place to start. A better way to think about MCH landscape and state. That's excellent. That's exactly what this will do. Ditto. Other thoughts? MCH work. Get a better understanding of this technique. Great. Utilizing it in your work. That's excellent. We're going to get to in the back half of this, really hoping to give you guys a little bit of time to practice this a little bit. And sort of get those ideas percolating and we've had to illustrate connections between community-based organizations. That's, yes, you guys are in the right place. This is the type of stuff we're going to be talking about. And so as we move into that, sort of things to think about a little bit, just to have on your mind, is think about your current work and how do you identify gaps or duplications in systems that serve your maternal health populations in the areas in which you work, and how do you currently consider whether these systems improve or worsen inequities? So sort of get that in your mind, send yourself on that of how do you currently think about these issues, especially in sort of the service provision aspects of your work. And so have that percolating for a little bit there. We'll jump in here. How many do we have? 34 folks. Looks like we stabilized. So before we get into the whole systems mapping, we want to unpack a little bit of what we mean when we talk about systems and systems thinking. So we thought it'd be worth doing a little bit of a primer on these concepts broadly before we then share the tool with you and get you guys really thinking about applying it to your own work. And as with many of these sessions, this sort of systems thinking aspect, we do full days on this with the MCH Workforce Center, and really can go very deep on all this. So again, we're just hitting the surface here, but we start here with sort of the systems mountain. And a lot of folks think that if you're doing systems dynamics and systems thing, you're jumping straight to the modeling part that requires math, lots of time, lots of perspectives, lots of resources to build these really powerful models that can be a great way to identify leverage points in your system, change those things to improve your outcomes that you're tracking via your data. And that's all very well and good. And we want people to do more of that. But there's so much more kind of on the way to that as you work your way up the mountain. And that starts at the bottom here with a systems thinking mindset, just approaching the issues that you're working with from a wider systems perspective, just having that mindset as you approach your work of how does what I do and the things I control, how does that relate and how does that nest within other parts of the broader maternal care system, the maternal and child health system, the public health system, social system in general. You can keep sort of building that out and thinking about those very important touch points between all those different systems. And so once you start thinking that way, then the next step up the mountain here are system maps. And that's what whole system mapping, obviously by the name of it, is one of these types of maps. And it's a pretty simple way to start mapping that. So once you're thinking in this space, then you can start to really define and describe the challenges you're facing through these systems maps. And that, again, is where you start to really increase your observations of different points that you may not have thought about otherwise, identifying those gaps in interesting and new ways and looking for ways to work in that space. So you can do a lot of impactful work just sort of on the systems mindsets and the systems maps aspect of this. And then that can all build towards systems models, which we're not going to get into the models here today, but just to sort of set that as context that there's a whole universe of systems work that you can employ in your maternal health efforts. So to start with, what do we mean when there's a system? So I brought my props with me because I'm in the office today. And so here's a Slinky. This is a system. And so I see some people nodding. You maybe have seen this before, but so hold it like this and observe very closely. I pull my hand away and something happens. So does anybody want to venture in the chat or come off mute? What is causing the system to behave this way? Put the hand there, remove it. Spring goes down. So why is it happening like that? What's causing that behavior? Physics. Yes, physics causes everything. Gravity, change. So there's a change, there's gravity, there's no support there. Okay. So you're observing that, the manipulation of the system, connection to its parts. So thinking about those, about gravity, moving my hand, some of that stuff. So if I hold up my lovely Maternal Health Learning and Innovation Center mug here, I hold this up and it's got liquid in it. I put my hand under it, same sort of context. I remove my hand. Luckily, the water doesn't spill out all over my keyboard in my lap here in front of me. So same thing, different behavior. So back to the idea of the physics, there's the gravity around that and the context of the system. But in this case, it's the structure of the system. It's the spring structure that is the main cause of that behavior. Certainly changing this context of moving my hand, the broader context of gravity is all part of it, but specific to this system, it's this structure. And so that's why it's really important to start thinking of systems as this aspect of interconnected elements in a structure. And that structure, when you start thinking in that space, again, is where you can start to really identify some of these different opportunities to intervene and produce the results you want to see. So system is a collection of parts, interact with each other to form an interdependent whole. Also think of that as a set of elements connected in a structure. And then the third part is a critical part of bringing it all together in a system that produces characteristic results. So here we're showing the set of elements. Those are all the pieces of a car. Thinking of your car as a system, there's all those elements there, but they're not connected in that first image. They're all spread out all over the floor. that is not producing the characteristic behaviors that we think that our cars should, if the purpose of the system of the car is to move you from point A to point B, just the set of elements alone is not enough to do that. Then up there on the top right, there's all those different parts and those elements interconnected in a structure there, but that structure is still not moving you from point A to B. It's creating a sculpture. It's something nice to look at. These are a cow and a horse maybe built out of parts of cars, but that's not enough to make the system of the car function. It's only when you get to that third image where that set of elements is interconnected in the quote unquote the right structure, the structure that actually ends up creating this automobile that can move from point A to point B. And so that's a real key, and the sort of most foundational part of thinking in systems is those three parts. It's a set of elements interconnected in a structure, and it produces a characteristic result. And we can often think about the characteristic result is what you state that the system should be doing, what you would like it to do, but then there's the real, what are the outcomes that the system structure is actually producing? And in often cases, it's driving outcomes that we don't want to see. It's pushing the system, the behavior of the system is not what it's designed or what it's stated to do. And it's in the design of that interconnected aspect of those different elements to where you start moving those pieces, then that's how you can try to achieve what the stated goal of the system is. And often there's a real gap between that stated goal of the system and then what the system's actually delivering. And it's not any one thing that's wrong with the system or any individual in there. It's because of all the forces that come together to create that structure of the system, and then it produces divergent results from what you're aiming for. And I mentioned earlier this idea of sort of nested systems and boundaries of systems. Here, illustrating again with the car. Internal to the car system, in this case, there's the exhaust system within a car that helps move the pollutants out. Ecosystem changes one thing, all other things. Yes, so that's getting to the leverage points, the comment in there. So the car system has subsystems within it, but then the car system itself is nested in the middle here in the highway system. And so that's the system of roads that cars use all across the country, and that's another piece of the system. But then on the right here, that can be nested in broader transportation systems that include freight, logistics, travel, alternative modes like light rail there, walking, biking. All of those are part of the transportation system, in which the highway system is one part, of which the cars are a subsystem within that highway. So again, just thinking about the different nested and scales of the systems, and really where the power happens is where those systems overlap and interconnect. And you want to think about the boundaries of your system, and that is often where some of these pain points are happening, and expanding your perspective to this whole systems perspective helps to make those connections and then actually be able to operationalize them in some of the activities you do in your various roles. So no matter what the challenge you're facing, it's affected by a system of some sort of interconnected elements. And that can be, again, biological internal systems to the human being, all the way up to the solar system is one huge system that I don't think anybody's going to be doing any work that's going to impact that level of the system. But somewhere in between our birthing people and the solar system, there are a lot of spaces for you all to do your work to try and improve those outcomes for the populations you and we all care about. And so when you do that work, you're working to often change something in the system. And again, this goes back to, well, what is the purpose of the system? In the left here, if the purpose of the tables and chairs is so we can all sit together at the same level and have a conversation, play cards, eat a meal, whatever it might be, someone had to intervene here because of the context and change the structure of that one chair so it still functions to become level with the others. On the right, this person has a bike, but maybe that bicycle originally for some reason was not doing what it needed to do to help that person not just move from point A to B, but move from point A to B with their groceries intact or whatever it might be. When I see this one, I don't know why he just didn't get a regular bicycle basket. They have those, but instead he changed the structure of his system to put the shopping cart as his front wheel and replaced it. So you can see where changing these different elements and the way they're structured within the system can help to move towards a more stated goal, sitting at the table together, moving and being able to transport goods on your bicycle. So again, just thinking about the different places where you can intervene in the system and expanding that scope, thinking about the different scales of where you intervene. So here with a more ecologically focused example, you can work with a single tree, you can work with some landscape trees, or you can work with the whole ecosystem. And each of those places requires a different set of skills and different set of perspectives on how to actually move the work forward towards, again, the stated goal or the de facto goal of the system, and bringing those closer together through a systems thinking mindset. So we talk a lot in metaphors with the systems work here. And I think you hear it when we talk about social determinants of health and thinking about root causes, working upstream, the public health pyramid. Here's another one. This is the systems iceberg. So thinking about the complex systems you work in as an iceberg, wherein the events that you see are really just the tip of the iceberg. That's above the surface. Those are the headlines in the papers. Those are maternal mortality statistics. Those are the numbers. Those are the things that everyone is really putting their attention on from a bunch of different perspectives. But once you get under the surface there's a lot of things that lead to those events within the system. So starting with under the surface of patterns of behavior, systems behavior over time. Why are those events occurring? What is the behavior of those events over time? What is the antecedent or the precedent of those events? How do you get to those events? There's things that are happening here, and that's where you can start to really break things down by race, geography, ethnicity, urban, rural, tribal communities, all the different ways you can start to look at, well, what's really happening that's driving that headline maternal mortality statistics? This is where you would then get into breaking those down by different subgroups and starting to look at, well, why are some aspects of the system behaving in a different way than others that are driving these events above the surface? But then if you keep going further and further down the iceberg, it increases your leverage for how you're able to intervene in the system. And the systemic structures, again, that's those interrelationships. What are the contexts of those behaviors? Often this can be the environments. What are the rules? What are the policies? Policies are a really big structural intervention in systems, because policies theoretically set the stage for a set of behaviors, allowing or disallowing certain behaviors, which then should drive the events above the surface there. And so this is where a lot of dynamics and a lot of the mapping really helps to identify these structures of the system that you're thinking about. And then finally, the lowest, the deepest level of the iceberg and the highest leverage point are these mindsets and mental models. So individuals have mental models based on their perspective of, well, why is the system structured that way? Why are individuals or the system behaving in a certain way? Why are we seeing those events? And broadly, those are mindsets in the community. So thinking about the norms of the community, the beliefs of the community, I think, systemic racism, institutional racism, a lot of those things are in the mindset that makes it baked into the structures that we see. So you get to the structural racism, you get to those behaviors of doctors not listening to women of color, then you get to the events of disparities in maternal mortality. And so really starting to piece that out and sort of stratify it in this way, and the iceberg itself can become a system map where you really start to look for, well, what are the intervention points beyond just reacting to the events, which we need to do. But if we're going to prevent those and have a sustained impact on the system, you want to start thinking further and further down about how do we change the structure? How do we make this behave in a different way? And that's when you have to get into these pieces and then start thinking even broadly about what are the things in the culture? What are the things in the mindsets of people that really need to change to facilitate those policies or those environments to then get to the behaviors that you want to see in terms of reducing or enhancing some of the events out in the community. So that's a very quick run through systems, and conscious of time here, so I'll just very quickly say there's two types of complexities when we think about systems. Detail complexity, this is sort of static. This is a care map of just all the different actors that have to help this specific family with a child with special healthcare needs. And I'm sure some of you have seen something similar to this of just how complex that gets. And that's before these parts even start interacting with each other and moving over. And that's the dynamic complexity of systems. And that's where you start to really see delays in information, cause and effect, nonlinear relationship feedback loops, all things we could continue to unpack, but in the interest of moving forward to the whole systems mapping, that's just something you want to think about, describing the system at a dynamic level, as well as, at a static level, as well as a dynamic level, are just the key basics to systems thinking. So what we want to do is get you into this whole systems mapping activity to think about yours and others' mental models of how are parts of the system working together, seeking to see that whole system in a more nuanced light, and then developing and testing models to change components of that system, start making those changes through your thinking, being able to identify those change points. And so I'll pause there as a transition and ask folks again to come off mute if you'd like to, or just put in the chat what I just ran through in a very rapid pace. What does that make you think about in terms of the maternal health systems in which you work and where you're coming from? So just a second to think about that and share any thoughts you have in that space. Patients are often working with a number of providers, some kind of across health systems, and they don't talk to each other well. Yes, that's exactly what we started want to be thinking about. There's different, health provider systems, the public health system. How do those folks interact with each other? Locus of power and who controls development of the culture and identification of resources. That's a great one when you start really getting into systems and who designs them, who has power over different aspects of the system. That's how you can really get into some of these underlying inequities that are driven much more by mindsets and structures than individual behaviors in the long run. Two-generation work, how maternal health supports are connected or not to other supports of families and young children. Exactly. So how are all these things interconnected? And everything's so segmented and not integrated. And I think that is ultimately where we want to go. And that's, if you caught in my wonky title that Christine gave, rather than just being a senior research associate, because I feel like I don't do much research, my descriptive title is senior research and health integration associate, because a lot of my work is about integrating those other sectors and into health and integrating health into other sectors that have more control over social determinants of health, like education, transportation, land use planning, community development. All those types of things require this sort of systems integration mindset. Look at this last one here. Sometimes, although those in MCH space are generally working for the same end goals, the fact that we work with different incentive structures and different levels of analysis, patient level versus population level, can make it challenging to actually align the work. And I think that's a great way to hand this over to Amy and thinking about that alignment and working at the individual level and the population level. And I think there's a lot of tension there that really needs to be better integrated and better solved to implement these population level solutions in a way that are actually going to impact the individuals living it on the ground. And so with that, thank you all for participating, and I'll hand it to Amy to start talking about what you're actually here for, whole systems mapping. Amy, take it away.
Thanks, Jimmy. Hi, everybody. I'm happy to join you this afternoon. And I just want to point out the last comment in the chat. It's who benefits from the existing silos. So I think that's can be a really powerful use of a whole systems map. If we document all of the different service providers or types of providers that are serving particular groups of women, it's a very intentional and methodical way to think about who's left out and why that might be, which circles back to Jimmy's comment about, systems sort of grow and design based on the mindsets of certain individuals who have power, and those are at the bottom of the iceberg, right? So if those systems that we all live in and exist in carry on generation after generation, we have certain outcomes, whether or not we are the ones who put those systems in place. So using simple mapping methods is not a magic bullet. It's not the only answer, but it's one way that we can really step back and visualize and see kind of the silos and what we're dealing with. So we're going to talk about a very simple, probably the simplest of all maps that you have ever built, called a whole systems map. And really what a whole systems map is just a set of questions that is designed intentionally to help you see a very high level view of a given system. So it is, keep in mind, this is the airplane. It is like a 20 or 30,000 foot view. You're not going to learn everything about everyone and every person in a given system using this method. But it is a great way to step back and look for gaps or duplications, silos, that sort of thing. So it's really just a set of questions. Let's look at the next slide, Jimmy. So here's a question: when should I make a whole systems map? There are lots of answers to this question, but really, one thing I'll preface this by saying is that a whole system map is designed really to look at service provision. So it's not designed to look necessarily at individual people or consumers or patients or clients in a given small closed system like a clinic. It's intended to look at multiple service providers who are doing similar, maybe not exactly the same, but similar types of services, to help give you a view of kind of what those services are and exactly who is it that you're serving that's kind of like who I'm serving, but I'm not exactly sure. And what about those other people on the other side of town? Who are they serving? The whole systems map is designed sort of at that level of service provision, not at an individual client or patient level. So if you're asking yourself these types of questions, it might be a mapping method that might be helpful to you. It's also really helpful in thinking about if you are in a position like in the state health agency, thinking about funding resiliency, like over time, where do we need to leverage policy to make sure that particular types of people are being supported in the ways that we feel like they should be supported? A whole systems map can help you think about who's paying for what in a broad service system, and is that resilient? Will that hold up over time? And the last question on here I think is really important. We're seeing people use these maps now to think about, given the fact, say, for example, you build a whole systems map and you end up with 15 service providers. When you step back and look at that map, one thing you might note is that we are leaving out one part of town or one group of people entirely. So it's a good way to ask yourself and really then operationalize action related to inequity. Like, is our collective work making things worse unintentionally? So this is a way that you can ask yourself those questions. Yeah.
Christine pointed out in the chat to Leslie's comment about sort of all this complexity. Where do you start? And I just want to raise that up because I think that's what you're touching on here is like, if you're asking yourself these types of questions in your work and this sort of whole system mapping as a space where you can start and then identify what part of the complexity do you want to dig into. But Amy wanted to make sure that was in your mind as you were going, sort of where do you start?
Yep. No, that's great. And it also reinforces the fact that when you see the whole system map that I'm going to show you the examples, like I said, it's the simplest thing that you will ever see. So the magic is not in the map. With systems thinking and with systems mapping, the magic is never in the map itself. The answer is not in the map. The answer is in you. And I'll tell the story about one of these maps, but really you can build a whole system map in a day or a week. The work that will be produced from stepping back at this 30,000 level oftentimes takes months or years to accomplish. So the work that is elicited is oftentimes illuminated though by a map, right? So you might look at the map and that will help point you in the direction of, oh, the biggest gap is here. We will start here. So sometimes having something like a mapping process or a facilitated discussion even is a way in to answering that question about where do we start. It all just seems so big and overwhelming. Sometimes just pausing and trying to zoom out and using some sort of mapping method can help answer that question of where to start. So I think I said this before. In particular, if you are, for example, at a large healthcare hospital system and might be in the position of sort of regularly convening a group of stakeholders, that's in the clinical sphere. In the public health space, if you work at the MCH Title V agency, if you work at a county level, and you're a regular convener of people, this is going to be great for you because you can be the one who says, hey, I think we should zoom out and see what kind of services we're providing. Because to build a map like this, it does require sort of a single person or a single agency that's willing to step up and convene a group and sort of facilitate this process. I think the easiest way to share about it is to share a couple of examples. So we're going to share a couple of examples. I'm going to talk about Colorado. This is a map we built with them a few years ago. And their goal was that several agencies in their state were concerned because they provide care coordination services for children and youth with special healthcare needs. And some of them became suspicious, like, we have a regional care coordination model for kids with special healthcare needs. And I heard that Medicaid has a care coordination model for kids with special healthcare needs. And I also heard that the state has a care coordination model for kids with special healthcare needs. And I wonder if we're serving any of the same kids, and like, how would we know that unless a parent told us? And then even if a parent did tell us that they were getting care coordination from 3 places, like, what would we do about that? What would that look like? So the first step in sort of unraveling that mystery at the State Health Department in Colorado, so this was led by the MCH division, the Colorado State Health Department, they sort of identified this as their challenge. They really wanted to improve collaboration across all of these agencies. They wanted to identify gaps. They were like, oh my gosh, what if we have all these people doing kind of this work? And what if there's like a whole giant group of kids that no one is serving? How would we know that? And they were, again, particularly concerned about duplication. And then to the point about sort of the long term, their goal going into this was they knew that they would find kind of a hot mess, and they wanted to be able to identify a concrete list of policy interventions. Like, they wanted to fix it. And they knew the way that they were going to fix it was not going to be like having individual care coordinators call the other care coordinator from the other program. Like, they wanted to really fix it sort of at the higher level, so that sort of the system would function more effectively overall. So that's the challenge. Let me stop and check the chat here. Nobody from Colorado that wants to identify themselves. So in its simplest form, a whole systems map is a table in Microsoft Word. I like Microsoft Word, so I tend to make them in Microsoft Word. You could make them in Excel, you could do it however you wanted. But like I said at the beginning, remember the airplane slide, it said that a whole systems map is a series of questions designed to show you the big picture of a service system. So in this case, for this map that Colorado developed, there were 7 questions. So the 7 questions that they came up with were: what happens, for whom, where, when, who, and then what are the outcomes of what happens and who funds it. We'll talk through this more. You can ask any question that you want. And really the hardest part about making a whole system map is coming together with a group of stakeholders to really clarify, what is it that we want to know? Do we care about the funding? Maybe we don't care about the funding. Do we care about the age of people that are being served? Do we care about the race of people that are being served? Do we care about the gender? Do we care about where it happens? Do we care about how long it happens? So you're going to be asking yourself, if you're the convener, like, what should we care about? What are the questions we want to ask? Usually folks will be part of an existing coalition. I was trying to imagine an example, like here in the prenatal care system that I used to work in North Carolina. There's a large university hospital where a lot of people go to deliver babies. So the hospital system itself has an OB clinic. There are tons of private clinics that refer to where people deliver at that hospital. There are several local health departments where people get prenatal care. They deliver in that hospital. There are many FQHCs that provide prenatal care services. All of those patients deliver at this hospital. There are a couple of birth centers that, for whatever reason, sometimes people end up delivering at this hospital. So a map that you could make, if you wanted to make, like, what do all of those different OB providers provide? The common factor, right, would be that all of those women and birthing people deliver at a particular hospital. But it might be interesting to some folks in that system to understand all sorts of things about all of those different providers in the system. So you can think about this at multiple levels. You can apply it really to any sort of context where you're interested in understanding multiple providers. So back to my Colorado example, I'm going to start and work left to right, and then I'll show you their full map. So this is a small slice. This is one row of their map. when they really committed to this and decided that they really wanted to take a deep dive and understand everything that was happening for care coordination for kids with special healthcare needs, they've actually found out that there are 6 service providers in the state, at least that they knew of, that were providing care coordination services for these kids. So all 6 didn't provide for all kids, but there was some overlap. And like Jimmy said, like it's where the systems overlap and interconnect is where the interest is usually and where the power is, sort of in terms of alignment and de-siloing. So this is one row of a whole systems map that has 6 rows in it, and I'll share the whole thing with you in a minute. The left-hand column, what happens, this is really the title of each of those care coordination services for whom. So here they asked very specific questions. They wanted to know about diagnoses. Is it all kids with special healthcare needs? And then they defined that. They wanted to know about the age that was served. They wanted to know about inclusion criteria. So they were very specific in each of these columns. So the general question is for whom, but specifically, I think they administered this as a survey. You can administer it as a survey. You can do interviews with folks. Oftentimes people will do it as interviews. It's just easier that way to find the one person in the agency who knows everything about a particular program and ask them these questions. I have also seen it really successfully done as a survey, like an online SurveyMonkey or Qualtrics survey. And if you're doing it that way, you can be really specific. So here, they were specific about for whom. They also wanted to know where, like, is this happening in people's homes? Is it happening in the community? In this case, it was offered in the local public health agencies, which I think is the equivalent of a local health department. And here they distinguished, apparently there were 2 levels of care that were provided. When, so this is an important question almost always to ask, what is the trigger for entry? Like, how does someone get into this service system? So in this case, people can self-refer, they can be referred by community-based organizations, they can be referred by providers, all sorts of ways people can be referred. And then who does it? Who provides the service? Here they define that it was a nurse-led team. And then what happens as a result? So in this case, they learned that this was a 6-month action plan. So it's, again, just kind of putting boundaries around everything that's happening in the system. And this group in particular, because they work at the state health department and work very closely with Medicaid, were very interested in understanding who pays for each of these types of services. So I'm going to stop there. I want to show you the whole map. Let me share the whole map so you can see it. This is their completed map. So I already showed you that top row. The second row is this other care coordination program. I don't remember all of the acronyms, but this was in 3 counties only. You'll see some similarities here, some differences here. They collected all this data and then they essentially tried to standardize it. So when everybody came back together to read the results, it would be clear kind of what was the same and what was different. The EPSDT program was also providing similar but not exactly the same type of care coordination services. Note that that was broader, that was for all children. It wasn't just for kids with special healthcare needs. But they did identify that there might be some overlap. So they were interested in learning more about that. A different local health department program that had some overlapping counties, but not exact overlapping counties. So there's just a row for each service provider, and you just get specific about what they do. Colorado in particular wanted to do this at this time because their Medicaid managed care program had just come online within a couple of years prior to that. And Medicaid managed care was also providing care coordination for children in particular regions. They were also doing this for kids with special healthcare needs. That was obviously a population of interest for them. And I will say one of the results of this process was that Medicaid was astonished. They had no idea that the state health department was providing care coordination for kids with special healthcare needs. And as over the course of a year to a year and a half of this relationship building work, Medicaid's sort of big takeaway was the managed care program said, we do not do this nearly as well as you do. Why don't we just pay you to do what you're already doing better than we could ever do it? So that was a pretty big outcome, and that wasn't the intent of doing the map, and the map was clearly just one step. The map did not result in that type of outcome. But these type of maps can sort of start these conversations where people then come back together, look at the map, and try to make sense of it. So let's go back, Jimmy, to the slides, and I'm going to take questions, and then I'm going to keep going and tell you a little bit more about the so what. Visually, that's a great question. Yes, so the question is, how might you present this visually? We often present it back to folks like this in a word table. I want to go back. Well, I'll get to that in a minute. I want to remind me to come back to the Massachusetts example, because the Massachusetts example had, I don't remember exactly, 15 to 20 service providers. So the table, they did build the full whole system map table as a reference. It was much too unwieldy to look at one time. So we built sort of a visual, really just up on the wall with flip chart paper is how we ended up building that. But I'll come back to Massachusetts in a minute. This goes to, I want to go back to Colorado. So the map itself was really just the genesis for these relationships. They brought together all these service providers. The fact that everyone, regardless of sort of their power in the system or their number of patients that they served in the system, everybody got a row in the table. They were all equal in that sense. So that really deepened understanding and trust. These maps are very simple, but they can go a long way towards sort of leveling the playing field. Right away, when they pulled folks back together, they looked at the map together, they identified clear areas where there was probably duplication and gaps. They were just, what they did was brought the folks back into the room together. They gave them 20 to 30 minutes to sort of absorb the results of the map together. And then we facilitated a process where everybody in the room got a chance to say, what did you notice first? What are areas where you have more questions? So they just developed sort of a facilitation guide that we walked folks through and just made sure that everybody in the room got to share their observations about what was happening in the map. And then one of the policy, I said they were really driving towards policy. They identified right away they were probably sharing kids in common, but they couldn't know, obviously, because they didn't have data sharing agreements. And it took them over a year, probably closer to 2 years actually, to get to the point where they could share data and share patient names and start case conferencing. They eventually got the data sharing agreements and started intentional case conferencing on the patients that people shared in common. And then ultimately they reconfigured who was serving whom based on those conversations. Some agencies stopped serving particular types of patients and made these agreements with the other care coordination agencies so that the service was a little more intentional. And then really they have, because to Jimmy's point, this is both a detailed complex system and a dynamic system. Things change over time, the policy changes over time, the funding changes for these over time. So they have this sort of ongoing relationship where they can flag. So it turns out that our money is different. We can't serve as many kids in this county this year. They have sort of this network now where they have built this trust over time. All right, let me go back to chat. Yes. Yeah, Adobe Suite, Publisher. Yep, there's all sorts of ways to show this. So I talked briefly about Massachusetts. I didn't want to cause you to go into meltdown, so I'm not going to show you their map. There were 18 agencies on the map. They were all interested in Massachusetts in understanding social emotional wellness for children. So Massachusetts is a very resource-rich state. This was also run out of the state health department, the MCH division. They were like, we know like 20 people who are interested in social emotional wellness for kids. foundations, 0 to 3 was a statewide program, early intervention, other Head Start, early Head Start, the school systems more broadly, public health system, home visiting systems, McPhee. There were all sorts of folks who were interested in the social emotional wellness of kids. So they did this mapping. We took the map because it was so large. Like I said, I feel like we did like 6 flip charts on the top of, in the front of the room, and we kind of sketched out what had emerged we had a mini team. We brought all 15 agencies together and sort of sketched out sort of what we felt like the highlights might be for the group. And then we did a gallery walk and we had them look at the results. And then we had them sort of write down their takeaways, put them up sort of anonymously. I remember one of the immediate takeaways was, we have like 10 programs that serve 0 to 5, 1 program that serves 6 to 9, and 10 more programs that serve teens or preteens, right? So there were some takeaways right away just from observing sort of the raw map that people came to. And then as a result of that conversation, that group decided, okay, we thought we cared about social emotional wellness for all kids. Really, I think what this group cares about is social emotional wellness for kids birth to 5. And I think the way that we're going to have the most leverage is if we write a policy statement, and then if each of our 17 organizations pushes hard on a joint policy statement for aligned resources or whatever. So they wrote this joint policy statement. You can find this on the web. I just pulled the first page of it. It's signed by many of those organizations that came together initially to build the map. And they pushed it forward, and they ended up with some significant policy change at the state level. So that was their goal, and they had a different goal and a different outcome. But it all sort of started again with this map, which is in and of itself no big deal. It was just a table, but it really allowed them to have these conversations that they wanted to have. All right, Jimmy, let's move on, I think. I'm just going to summarize. If you wanted to build a map, what it would look like. You're going to set the boundaries for the system you want to map if you know them. So either by geography, in Massachusetts, right, they started with 0 to 17 and they ended up making a smaller map that was 0 to 5. So if you know the boundaries, geographic or otherwise, you would set the boundaries. And then next, because I don't have the slide memorized, Jimmy, you'll have to push the button. Identify types of information you want to include. So that's pretty clear just across the top. Those are going to be the columns of your map. What information do you really need to know? And I'll give you some pointers on the slide later. Then just build yourself a survey. If it's really simple, you could just build yourself a table in Microsoft Word, list each of the agency A, B, C, D. Each of them gets a row. You could send it out and say, you're row D, fill it out and send it back to me. All sorts of ways you could do it. You combine it. If you're the convener, you would combine it into a single visual table. Go ahead, Jimmy. And then importantly, I think this is a critical piece. If at all possible, please reconvene everybody who contributed to the map, give them back all of the data together, and ask them, what do you notice? Sort of design a facilitated conversation. And the ultimate goal is really just to elicit their feedback. What did they notice and what can be improved? And from here, the real work begins, because then you're planning for next steps. So what do we do with this now that we know what are our next steps? For most groups, in my experience, that's pretty obvious. There are obvious gaps. There are obvious duplications or whatever. They saw what they thought they would see, or they saw something that surprised them, and the next steps are generally speaking pretty obvious. All right. I want to give you 5 minutes of quiet time to think about how you might use this in your own work, and grab a piece of paper and draw yourself a table and start a map. What are the questions that you might ask on the top, and who are the people that you might invite? If you think this is relevant, if it's not relevant for you, don't force yourself into a fake academic exercise. But if it's at all relevant to you and you're wondering, how might I use this? Just try it. Sketch it out on a piece of paper, and and see how it goes. There are some examples of questions here on the slide. So we'll just leave this slide up, and I'm going to give you maybe 4 minutes till 2:38 Eastern time, and then I'll just ask for some reflections. Any questions before we move to the quiet time? All right, have at it. All right, I'm going to call us back together. Thanks, everybody. Hopefully that was enough time to get started on a map. I'm just going to say a couple more things and then we'll move into reflection and close. One thing I just want to reiterate is this is a very simple method. It really is just designed to get a high level view of service provision in any given space. If you feel like you would benefit from having some support in setting one of these up, if you are affiliated with a state MHI program or a state RMOMS program in the maternal health space, please reach out to your MHLIC coach. We would be happy to help you work through this. If you are not affiliated with your state's MHI or RMOMS program, that's also perfectly fine. We do this work also in the National MCH Workforce Development Center. We would be happy to help you that way. To access that, you'll need to work through your state's MCH Title V program. So hopefully you know your MCH Title V program. You can reach out to them and just ask to be connected to the MCH Workforce Development Center, and we would be able to support in that way. I'm going to open the floor for these reflection questions. Anything that surprised you? Any way that you think you might be interested in using this in the future? Anything that you might need, or who else you might need to work with you to build a map? Just your thoughts in general. Please feel free to come off mute.
Wondering if I could ask a real quick question.
Sure.
So background, I'm Anjana. I am the Linkages to Care Coordinator at Maryland Department of Health. And I am going to actually be doing something, if not the same thing, then something very similar as a part of one of my projects. I'm situated within the Overdose Data to Action Grant. So this is like one of our topics, and we're focusing on like mothers, the maternal child health population with relation to substance use disorder. And so I have never done this work before, and so this presentation was really helpful because I just didn't really have a background to it. And I'm wondering if it would make sense to like engage with stakeholders on a regular cadence in order to like get this work done. I know you said that this doesn't have to take long. I'm just trying to get an idea of what timeline would make sense. You know, like is it a month? Is it longer? I mean, because on my end, I have like a work plan that I've had to like start from scratch. And I'm like, I don't know if this makes, you know, if this lines up right or what, but this was really helpful. And thank you for sharing these resources. I got a lot out of this presentation, so.
Sure, that's a great question. Yes, I feel like the easiest way to do this is if you are already sort of in relationship with a group of stakeholders. So if you have an ongoing relationship and it's one of your goals to understand each other better, this can be something you would do as part of a regular quarterly meeting. I've seen it done like that, where there are sort of these coalitions that have a shared goal, but sort of slightly different pieces of the pie, but they'll use this as an activity for one of their quarterly meetings or their monthly meetings, where they would ask people, hey, we're going to try something fun. We'll see if it works. Please fill this out in advance of our next meeting. And then they would share the results of the map at the meeting. You don't even have to call it a map. If you don't have to give it a name if that makes people feel nervous about it. So I think in the context of a regularly occurring coalition makes the most sense. I have also seen people use this sort of as a way to kick off a coalition. We think that we're all interested in overdose prevention. We think that we are all doing something in this space, but we just really want to get together a couple times and figure out what it is. So you might have an introductory meeting, you might throw out this idea, see if it's of interest to people, and then at a subsequent meeting, you might either give people time to work on a map or share the results of the map.
Yeah, and I would add to that as well, sort of thinking about it as a thing to come back to with that group of perspectives. And it can, you know, over time, we've seen these and other system maps really become that glue that holds a group together. They come back and see themselves in that, talk about what they've been doing. And then the caveat of if you go that way is to make sure that those people were a part of developing it in the first place. And as new people come in, they have a chance to refine and change it. Because in some of the work we've done, not specifically with the overdose to action, but in our opioid system, in one state I was working with, we used a past system map to try and facilitate this dialogue with them about their strategic plan. And then it turned out none of those folks were into that because they weren't the ones who helped build that map. So even though it made sense to us and is still a really powerful tool, they didn't want to use it because they weren't there about building it. So as you think about using these in your work, again, think about it as that space to bring perspectives together and continue to do that throughout. And you can make it match up against your grant deliverables or program deliverables, whatever you need to do. But think about it not as a one-stop shop, but as a range of activities that really help to reinforce that broader systems perspective on all the work.
So we're officially at time. I can leave this room open longer if Jimmy and Amy, our speakers, are able to stay a little bit longer. There are questions, and Amy also shared her email address with you, Allison, but feel free to stay a little bit longer. There is a break until 3 o'clock, and then we look forward to seeing you all in the next concurrent sessions. Thanks, Amy and Jimmy.
Thanks for joining, everybody.
Thanks for participating. And yeah, we can sit here and answer a couple questions, I think, or I'll speak for myself. I can, and then I'll just give you Amy's email address if I can.
Hi, this is Allison. Thank you for staying after. So I work with the Title V program in Arizona, and I guess my question was, I was just curious about the use of this systems mapping for something that has a broader scope. Because I guess when I was kind of doing the examples, I could really think about how it would work for something granular like safe sleep education. But when I try to think about something like everyone who's working on child health, different aspects of child health services in the state or something like that, it gets kind of overwhelming very fast. So I guess I was just curious if you've seen it used in those for those broader boundaries, and was it effective, or is it more useful to really hone it in?
Yeah, I can take a stab at that and say, Colorado, when we first talked about using this with them, wanted to do the whole thing statewide. They wanted to do all their interventions statewide. They wanted to do everything statewide. We encouraged them to try testing in a region. So I'm thinking like for child health services, you might want to just try it if there's a regional approach for certain counties, or like the largest county, for example, or maybe not the largest county, a medium-sized county. Take a smaller slice, build a map for that. So that gives you, then you'll know which of your questions, the column questions, work and which ones maybe you thought would work and didn't get you what you wanted. So I would recommend starting that way. And then you'll know if it feels scalable, you could scale it, or if it doesn't feel scalable, maybe not. Jimmy, do you have other thoughts, like of other mapping methods that might be able to get at something like all the child health services?
Yeah. Like you're saying, it becomes very complex really fast when you start to think about the system of everything. And so using this sort of whole suite of tools, there are like Iceberg and things like that are ways you can start a conversation with different groups and then hopefully find through that, like, okay, we're not going to be able to do the whole child serving system now, but let's find that piece of it that we all have a good perspective on and can start asking these questions. And again, getting that mindset and thinking of this, because then ultimately you can really get to mapping and modeling the huge complex systems, but that's just not the best. That's not a good place to jump in and start if you've not already laid a lot of the groundwork with those partners to do that type of work. And like Amy said, find a smaller geography or a one specific type of service to then dig in on.
Oh, Allison, you're on mute.
You're on mute.
Thank you both. And I do have another question, but I'll wait and see if other people have questions.
I do have a question, but Allison, your question was almost pulled right out of my mouth. So please ask your follow-up.
So I guess my follow-up question was, when the challenge is identifying the who, do you have recommendations for that? Because sometimes that's what we're really trying to figure out, is who is working in this space.
Okay, I'll start. I definitely don't have maybe a great answer. I feel like in identifying the who, what I have observed is people are often successful using this snowball technique, right? If you identify the 5 people that you think will know everybody, and you don't go to them with an ask that's related to themselves, but rather what I really want is to get everybody. Who are we missing? And then ask them for 5 more people, and then ask those people for 5 more people, and just being really intentional about, are we paying attention to community partners? Because that's what you'll see a lot, especially in the maternal health space. There are a ton of community organizations that are doing maternal health work that those of us in traditional institutions never see. And once you find one of them, they're like, well, did you know that there are 17 other very small Black-owned maternal health organizations in our very city? And so we're like, they could do a whole network map, and the traditional organizations could, but once you provide an intersection space for them. So, I mean, that's not a very complex answer, but snowballing and paying attention to who you think might be missing, and then just making sure you keep going until you find a trusted person in the community who can
And I think
unearth those.
that it's kind of where I was going is the, again, this specific whole system mapping based on services is not the ideal one for this sort of end user perspective, but a lot of these system tools, we've, especially through the Workforce Center, have gotten to a simplified enough nature that you really can, with minimal sort of coaching and support, actually have community members, your end users, the people you're serving, create their own maps, and they tell their perspective of the system. And that's where you're going to find, oh man, we didn't know about all these organizations on the ground that our clients are actually interfacing with. Let's get them at the table. And so the snowball can start rolling from a lot of different places in the system, because the high level folks are going to know a lot of folks in certain roles, but that end user who ultimately really want their perspective to drive everything, they're going to have a different view, and open your eyes to some of those other people who you then have to, work to build the relationship to pull them into your process, however it's relevant for them to do.
Yeah,
Perfect.
and Jimmy, that makes me think of, there was one slide in this deck that was a hand-drawn, I don't know if you remember, it was a hand-drawn, so there was a child in the middle of that, and a mom is a child with special healthcare needs, and the mom did like color-coded, everybody in blue is the healthcare system, and everybody in red is the education system, and everybody in, she just did that because she couldn't like manage all of the people who were interfacing with her child. That particular map, it's called Gabe's map, has become quite famous and has been the genesis for a lot of systems tools that help end users tell their own story in a way that is helpful to those of us who provide services to really understand their context. So they're not just like put on a stage and telling their story without guidance, but there are some systems methods that, so like Jimmy said, not the whole systems map, that is not for an individual user level, but there are others that can help us learn from end users by telling their story in intentional ways.
Well, thank you both.
Katie, did your question get answered, or?
I think so, mostly. I think, Alice, we're in a colleague and I are in a similar situation, but we jumped in too deep, too quickly into network mapping in an early childhood family supports project, trying to map out every program funded by every federal agency, and we wanted to know the towns where families were being served, the areas, the types of services that they were getting, and it was too much. the questions that we were asked. There were too many questions. And so we have an opportunity now to kind of take a step back with a parallel project to help them figure out who should be at the table, who are the network of family support providers within this county. And so I'm interested to take that step back and jump in a little bit more shallowly. Yeah, so sorry, not really so much a question. I think what you all shared was reassurance.
So wade in, don't dive in.
Yes. We'll wear our swimmies.
And there's something in there with the iceberg too, and we could stretch the metaphors.
Yeah.
Awesome. Amy, did you have any last thing to say?
No, thanks,
Okay.
everybody.
Yeah, thank you, everyone. And thank you, Amy and Jimmy. And just a reminder that the next sessions start in 5 minutes. So go take your bio break and we'll see you there.
Thanks, everybody.
Bye.